If you are over 70 years old, I need you to listen carefully, because what I'm about to share could protect your health, your safety, and even your quality of life. For decades, doctors have recommended routine health screenings as a way to catch problems early and extend lifespan. And while that is true in many cases, the medical world is also beginning to recognize that not all tests and checkups are helpful as we age. In fact, some can actually be harmful, leading to unnecessary anxiety, dangerous procedures, and side effects that outweigh any possible benefits. As a physician who has spent years working with older adults, I have seen the good side of preventive medicine. Lives saved through timely diagnosis, patients reassured by normal results, and problems stopped before they became dangerous. But I have also seen the darker side: unnecessary biopsies, painful treatments, and even hospitalizations that began with a screening test that, truthfully, should never have been done in the first place. The key to longevity and quality of life after 70 is not about running every test available, but about choosing wisely, understanding which tests still help and which are more likely to harm. So today, I want to walk you through 5 common health checkups that you should think twice about after 70. These are tests that may sound harmless or even essential, but that research now shows can cause more damage than benefit for seniors. Please understand, I'm not saying you should avoid all checkups. Far from it. Preventive care remains important at every age. But knowing which tests to avoid can help you stay healthy, reduce unnecessary stress, and focus on the exams that truly make a difference. Let's begin with the first one: routine PSA screening for prostate cancer. For many years, doctors encouraged men over 50 to get a blood test for prostate-specific antigen, or PSA, every year. The idea was simple: catch prostate cancer early, treat it, and save lives. But over time, we learned that the reality was not so simple. PSA levels can rise for many harmless reasons: an enlarged prostate, an infection, even riding a bicycle. Yet a slightly high PSA often triggers a cascade of stressful events: repeat blood tests, invasive biopsies, and sometimes treatments like surgery or radiation that carry very real risks: incontinence, erectile dysfunction, and chronic pain. Men over 70, the risk of aggressive prostate cancer is much lower, while the risk of side effects from unnecessary treatment is much higher. Studies have shown that routine PSA screening in men over 70 does not extend life expectancy, but it does increase complications and suffering. That's why major medical organizations, including the U.S. Preventive Services Task Force, recommend against routine PSA screening after 70 unless you have specific symptoms or a strong family history. The smarter approach is to monitor urinary health, watch for changes in urination patterns, and discuss concerns with your doctor rather than relying on a number that often misleads. Now, let's talk about colonoscopies. Colon cancer screening saves lives for many adults between 50 and 65. But after age 70, especially beyond 75, the balance begins to shift. Colonoscopies carry risks: bowel perforation, bleeding, infections, and complications from anesthesia. And it's important to understand that colon cancer grows slowly. For many seniors, the cancer would never cause harm within their natural lifespan. Yet the complications of the test itself can be life-threatening. This doesn't mean you should stop caring about colon health. Less invasive options, like stool tests for hidden blood, are often safer and more appropriate. If your last colonoscopy before 70 was normal, and you have no alarming symptoms, repeating this test may expose you to more danger than benefit. The third checkup to reconsider is mammography for women. Breast cancer screening is life-saving for many younger women, but after 70, the picture changes. Breast cancers found in older women are often slow-growing, and research shows that aggressive treatment may not extend life in many cases. Meanwhile, mammograms after 70 frequently result in false positives, leading to unnecessary biopsies, surgeries, and anxiety. This does not mean older women should ignore breast health. If you notice a lump, nipple discharge, or pain, you absolutely need to see your doctor. But as a routine yearly test without symptoms, mammograms may do more harm than good after 70. The smarter approach is breast awareness, paying attention to changes in your body, and individualized discussion with your physician instead. Of blanket screening. Next is routine whole-body scans, such as CT scans or MR, is just a check. I cannot tell you how many patients over the years have come to me requesting full-body scans because they wanted reassurance. The problem is, these scans almost always pick up harmless findings, small cysts, benign nodules, age-related changes, things that would never have caused any problem in life. But once they are found, doctors feel obligated to investigate. This leads to more scans, biopsies, and sometimes even surgery. And let's not forget, CT scans expose you to radiation, which itself increases cancer risk over time. After 70, the risk of chasing false alarms far outweighs the chance of finding a dangerous disease early. Medicine is not about scanning everything. It's about wisely targeting real concerns. If you have symptoms, yes, scans can be essential. But as a blanket screening tool, they often cause harm. Finally, routine cardiovascular stress tests in symptom-free seniors are another checkup too. Avoid. These treadmill or imaging tests were once promoted as ways to find hidden heart disease before it strikes. But for people over 70 with no symptoms, the predictive value is low, while the risks of unnecessary procedures are high. False positives often lead to invasive angiograms or even stent placements that may not improve survival in symptom-free seniors. The better approach is to focus on managing risk factors you can control: blood pressure, cholesterol, blood sugar, and lifestyle. Choices like diet, exercise, and stress management. Those have a far greater impact on your heart than a screening test you don't need. So there you have it. 5 health checkups that many seniors think are protecting them, but that may actually harm more than help. PSA tests, colonoscopies, mammograms, whole-body scans, and routine stress tests all have their place at younger ages. But after 70, they require much more caution. The most important lesson is this: healthcare should be personalized. No test should be automatic. Every decision should be based on your overall health, your values, your family history, and an honest conversation with your doctor. I know this information may feel unsettling, especially if you've relied on routine checkups for decades. But think of it this way: your goal after 70 is not endless testing. Your goal is quality of life, good sleep, healthy movement, enjoyable meals, strong relationships, and peace of mind. The best tests are often the simplest: regular blood pressure checks, monitoring your weight, staying active, and being aware of new symptoms. These things tell us more about your health than unnecessary scans or screenings. Remember, Avoiding harmful tests is not the same as avoiding doctors. Preventive care is still essential. But at this stage of life, less is sometimes more. By focusing on the right checkups and letting go of the ones that do more harm than good, you give yourself the best chance at living healthier, longer, and with greater peace. So I leave you with this question. Are you ready to talk openly with your doctor about which tests you really need and which ones you can confidently skip? Your health deserves wisdom, not just routine. Take charge, make informed decisions, and live your best years with clarity and strength.